Circumstances under which I may start my tenure as Surgeon General this time are quite different from when I was Surgeon General last time. We were facing an opioid crisis last time. We were struggling with another pandemic, with another outbreak, I should say, which was Ebola at the time, and soon Zika, the Zika virus would follow. But COVID-19 has affected us like no other outbreak and pandemic in our lifetime. And it has been just profound in terms of the extent of impact, not just on our physical health, but really on our mental health and well-being. This really has to be a really tight partnership between the states and the federal government. And by partnership, I mean not a one-way street, but really a two-way street. There's a lot that states are doing on their own right now, which the federal government can not only learn from, but can help share with other states. And there are also capabilities that the federal government obviously has in terms of procurement of vaccine, getting that vaccine out to states expeditiously and in a predictable way, making sure that guidance, around prevention, around how to use the vaccine and distribute it to the population in terms of priority levels, that is explained clearly. And these are places where the federal government can play an incredibly important role, as well as, of course, resources. There are times where we are 50 states and there are times when we're one nation. And this is one of those times where we have to stand together as one country, where we have to pull together the resources that we need. And we've got to get them to people who are either struggling with loss of jobs, loss of home, with mounting healthcare bills, because right now we've got to stick together. That's how we get through this pandemic. We have a challenge now, a challenge to ask ourselves what values really matter to us. And are we willing to do what it takes to live up to those values? If we truly believe that we are a country where every life really does matter, where everyone deserves a good shot at a healthy life, then we've got to build a system that actually delivers on that promise. And what that means is a system where people do, in fact, have access to health insurance coverage. It means a system where your ability to get care is good in urban areas, in rural areas, where your ability to access well-trained nurses and doctors is uniform across this country. But it means a country where we focus on prevention as well, where we support efforts to make neighborhoods safe, where housing is available to everyone, and it's not, and when we don't have the profound homelessness crisis we have, which is, as your Lieutenant Governor, Dr. Green knows, homelessness is a health issue and is a health crisis. And have really admired some of the work that Hawaii has been developing, to address homelessness. So the more we dig into issues around equity, what we find is that the ingredients to good health, to equitable health, are rooted not just in our hospitals and our clinics, but in the structure of society, in our schools, and how well they do and how well they support our kids. They're rooted in our workplaces. They're rooted in access to strong local public health. And COVID has exposed that too, that many of our local departments of public health, which we rely on during times of outbreaks, but also in between, that they have been struggling for decades with improper funding and insufficient funding, with a lack of resources to support personnel as well as technology infrastructure. This is our time, as profoundly difficult as it is. This is our time to look at those deeper challenges, to fill those holes, to close those gaps, and to ultimately ensure that when we come out of this pandemic, we're not just getting rid of COVID or suppressing COVID or managing it, but we're building a healthcare and public health system that is much more strong than what we had before, and that really serves ultimately our values, which is to ensure that everyone, every man, woman, every child in our country has access to the kind of healthy, fulfilling life that they all deserve. I remember as a third year medical student going into the hospital and my preceptor telling me that the single most important mistake that doctors make is they cut patients off and they try to diagnose before they listen. And so I thought, well, maybe this is one of those moments where if I'm feeling confused and unsure about, who to believe and what data to follow, I should just actually go out and listen. And so what happened to me is when I visited communities, big and small, all across the country, I would go in with just a simple question and ask people, well, how could I help? And I would try to listen to what they said. Some of the things they told me would not be surprising to you. People talked about their struggles with substance use disorders. They talked about the difficulty their kids were having with depression and anxiety. They spoke with great concern about how to handle social media, how much time to let their kids have on before screens. And they worried about the rise in obesity and heart disease that they were seeing around them. But the thing that surprised me, Maya, to your question, was that behind so many of these stories, there was this deeper emotional pain that I would sense. And in the beginning, I didn't quite know how to address it or what to do about it, but it was a familiar theme. And so I started asking people more about whether they felt fulfilled and happy in their lives, about what was actually bothering them. And what I came to see was that at the root of so many of their stories were these deeper threads of isolation and of loneliness, where people felt like they had to really deal with all of the challenges in their life by themselves. And they wouldn't come up to me and say, hi, my name is Maya, my name is Vivek, I'm lonely. But they would say things like this. They would say, I feel like I have to deal with all of these struggles by myself, or I feel invisible, or if I disappear tomorrow, nobody would even care. And hearing that not just from people who are in the twilight of their lives and living alone, but also hearing this from college students who are on college campuses with thousands of other students, hearing it from moms and dads who are working in jobs where they saw people in the workplace and in their neighborhoods, but still felt alone, hearing it from CEOs and from members of Congress, even who behind closed doors would confide in me that they too were struggling with loneliness. It helped me realize that there was something far deeper that was happening in our society, something that I had interestingly seen in my own life as a child who struggled with loneliness for many years. In fact, my like hardest times in the day were in the morning as a child when my mother would drop me off at school and I'd feel this sinking pit in my stomach because I wasn't scared about teachers and exams. I was actually scared about walking into the cafeteria and having no one to sit next to. I felt profoundly lonely, and that resurfaced many times during adulthood. And I was also reminded during this time as Surgeon General, seeing so much loneliness, about my experience as a doctor, who never really learned about loneliness and isolation in medical school, but who every day in the hospital saw patients who would come in with serious illness and have to deal with really difficult decisions about whether to go down a treatment path or go for surgery or not. But they would have to do that all on their own because there was nobody that they had to confide in. So that remains one of the most profound, for me, realizations. And it was a point of education that I was blessed to receive from the people that I met all across the country. There are a couple of things I think that I would offer that I hope can be helpful. One is, even though we're quite separate during this pandemic, it turns out that small amounts of time that we may spend with one another, when done in a regular basis, can actually have a profound impact on how connected we feel. So if we are able, for example, to just make 15 minutes each day to spend with people we care about, that could be simply having a conversation, with your sibling or with your parents or with a child. It could be calling up a friend on the phone or video conferencing with them just to say, hey, I'm thinking about you. I wanted to see how you are. It could be writing an email to an old friend just to check in and see how they're doing. But those 15 minutes can make a profound impact when done regularly over time. The second thing that can be powerful is to make that time really count. And the way you do that is by eliminating distraction when you're engaging in conversation with others. It turns out that one of the greatest gifts that we can give one another is the gift of our full attention. But partly because we have been blessed with technology, we've also unfortunately experienced the curse of technology, which is that it can intrude on our conversations and distract us. I'm no different than anyone else in the sense that I've experienced many times how distracting tech can be, and have found myself sometimes during conversation with somebody just reaching into my pocket and pulling out my phone and checking my email. And I have no reason to really check my email, but it's just become a habit, and so I do. And then before you know it, you're in a message, and you think you can listen on the phone and check your email and Google the scores from the game last night. And the truth is, science tells us very clearly we can't do that. That when we're actually multitasking, we are giving neither task our full attention. And the truth is, many people often realize that. But it turns out if you've had the experience of being fully immersed in conversation with somebody, giving them your full attention, being truly open with them, and listening deeply to what they're saying, then you know that 5 minutes of fully present conversation can often be more powerful than 30 minutes of distracted conversation. So that's the second thing I'd keep in mind. And the last couple of things to mention is that number three, it turns out that serving others, that service, can be one of the most powerful antidotes to loneliness and separation. And this has to do with how loneliness actually affects our body. It turns out, for evolutionary reasons, that when you're lonely, that your attention actually turns inward to yourself, that you become more suspicious, if you will, more of others around you, more hypervigilant, and you also experience an erosion of self-esteem over time as you come to believe that perhaps you're lonely because you're not wanted, or because you're not lovable, or because you're not likable. And what's powerful about service is it flips those patterns on their head. It short circuits those really deleterious patterns, and it does so by shifting the attention from you to somebody else, the person you're serving. And it also reminds you, those acts of service, that you do have value to bring to the world. And in this moment, there are many ways to serve one another. Simply dropping food off to a friend who might be struggling, or a neighbor who may be scared to go to the grocery store because they're worried about the pandemic. That is an act of service. Calling a friend to check on them because you know they've been having a hard time. That's an act of service. Offering to just even virtually babysit for 10 minutes for a friend who you know is struggling with homeschooling their children while also working from home. That is an act of service. So if we look carefully, we'll find there are many ways to serve. For kids in particular, but really truly for all of us, I think it's worth remembering one last thing, which is that our ability to connect with other people is built on a foundation of connection to ourselves. And what does it mean to be connected to yourself? Well, it means to be comfortable with yourself, to know your value, to understand your worth. What's powerful about building connection to self is that, yes, it can come from our relationships. Sometimes great relationships can reaffirm to us who we are, serving as mirrors that we often desperately need. But moments of solitude as well can be very, very helpful in building that connection to self. As Maya was saying earlier, there's a difference between solitude and loneliness. Solitude is a welcome state of aloneness. Loneliness is a state of aloneness that brings pain and despair. But we have become less comfortable with being alone, with solitude. And one of the challenges we face today is how to recapture some of that comfort, how to find just 5 minutes a day, for example, where we can sit on our porch and feel the breeze against our face, when we can enjoy a few minutes of meditation or prayer or just being in nature. Those few minutes, as simple as they are when we gather ourselves, when we reground ourselves. Those are the moments where we reflect, when we simply be. And when we approach our relationships with other people, our conversations with one another, from a place of being more grounded, more connected to ourselves, then we're more able to be present with other people. We're more able to show up as who we are authentically, as opposed to trying to be who we think they want us to be. So even though we're in the midst of this very difficult pandemic that's preventing us from going out and seeing each other, these simple tools of 15 minutes a day, being present with one another, seeking opportunities to serve, and investing in these moments of solitude to deepen our connection to self, these can help us build a more connected life. And if we all do this together, that is how we ultimately build a more connected world.